I'm Kim Lundin, Development Officer at CAP with Tyler TerMeer, CAP's Executive Director, and we are so excited to give you a tour right now, live, of our new health center, Prism Health, on Belmont. So come on in. So here we are in the lobby of Prism, and I asked Tyler to come down here today especially because it's a day when we're thinking about how far we've come in the last 8 years, and some of us are a little nervous about challenges looking ahead. And so I thought it was a great time to focus on what CAP is doing to secure our future. So Tyler, are you thinking about those things today?
Yeah, of course. You know, I think we have just come off of an amazing 8 years with a presidential administration that has been incredibly supportive of our cause. We had the first national HIV/AIDS strategy, a real blueprint for how we move forward, and a strong commitment to funding for HIV/AIDS services as well as LGBTQ rights. So now, obviously, it's a natural time for folks to feel nervous about what a new administration may mean. We have programs that are already being challenged that support our community, the Affordable Care Act, Medicaid, Medicare, and even the rights of the LGBTQ+ community. So we've got a lot of work to do, but I think as CAP moves forward, we are really committed to keeping the community informed, to following these policy issues, and to reassuring you that no change is going to happen overnight. That we've got time, and we will use that time to make a plan for how we will continue to provide a robust set of services and programs and grow our programs just like health.
Yeah, so we're here today, we're moving forward. As you have probably already heard, this is a live construction site, and we're not stopping the work we're doing. So forgive us a little bit, you're going to see construction guys walking around in the background, you're going to hear saws like that one, but I just think this is so exciting to see this thing just be born as a gift for our community. So Tyler, why don't you tell us a little bit about where we are?
Yeah, so when you arrive at Prism Health, you will enter our waiting room area. You will be greeted by our receptionist, who is a certified medical assistant working on front office, or by either our health services coordinator or manager of healthcare operations. They are staff that are already hired or in the process of interviewing for our health center, which we hope to be up and running in the next couple of months. We're really excited about the look and feel of this space. We did a lot of work with the community. I know it may not look like it at the moment.
It's very broad right now.
I know. But we did a lot of work with the community to try and figure out what was important to them, what would make them feel safe about the atmosphere of their healthcare experience. We took all of that back to our architects and our construction crew, and I think we've designed a space that you'll really love.
And that's what it's about, right? Making a space where people feel safe. When you come to the doctor, it can be super scary for people, so we want them to feel welcome. Is that where we're going with this?
Yeah, you know, we've heard a lot that people didn't want the traditional, very clinical primary care experience, and so we are designing a place that's not only culturally affirming and safe, but feels like a place that you want to come, that you want to see your provider, that you want to hang out, and that overall you'll feel connected to your healthcare and safe in the services that we're providing.
Awesome. Is there anything specific in the lobby that you're excited to see built?
Yeah, you know, we tried to preserve as much of the natural glass in the front of this building as possible.
That's nice.
And so in the future, this area will be kind of a bench seating area where folks can still enjoy the view of Belmont, but still interact with our staff as they're waiting on their appointment.
Fantastic. All right, Tyler, well, if you will, take us into the clinic.
Yeah, so we're hoping to offer a whole set of primary care services. So what that means for us is, you know, you would go to the doctor on a well visit for a flu shot, for any care need you may have, just your annual checkup. We can offer that here, but what makes us unique is that we are an organization that can offer that by providers who are trained to be culturally affirming, who understand the unique health disparities of the LGBTQ+ community, and who are going to be there to answer your questions and to think proactively about the things that will be impacting your health. Not only will we offer primary care, but we will have mental health counseling on site. We have built 6 mental health rooms, which are going to be down this hallway and then have one larger room that's designed for group therapy or for family visits.
Excellent. Fantastic.
So then if you want to follow me back this way, we have a doorway here in the future, and this doorway you will be guided back by either a certified medical assistant or one of our nurse practitioners. They will bring you back to what will be the main health center space for the community. This will be a busy area here where our staff, either from our low barrier HIV testing program that's been known as Pivot, will be working, or our current nurses staff will be here as well. And then back in this space, I should have brought my headphones. Back in this space here are going to be 10 primary care exam rooms.
Wow, 10 rooms.
Yeah,
that's
10
fantastic.
rooms. We're really hoping that we grow over time, and we have learned from other LGBTQ clinics around the country that the demand is really there. People have been really wanting a healthcare experience that is safe and non-judgmental, and that's the practice that we're designing here at Prism Health. So these 10 exam rooms won't be up in full swing from day one, but we know that we will grow over time, and we wanted to design a space that will be here for the community, ready and I guess just not having to do more construction down the road.
Yeah, that's great. We're going to walk past the station here. You guys hard at work?
So not only will you see the primary care visit rooms back in this space, but we have built in addition to all of the mental health counseling rooms and the exam rooms, room for lab draws. So Quest Diagnostics is our lab partner. We have built in each of these rooms and all of our workstations an electronic medical record. We've partnered with Ocean, who is helping us Epic, an electronic health record that's used around the country. It's a great system, an expensive one, but one that we are investing in because we want the best for those patients who will come here to Prism.
It's worth it, right? And part of that is handling folks' medical records properly. Is there special training or issues that we're working with?
Yeah, Epic will allow us to not only have a very sophisticated medical record, but through a program called Care Everywhere, will allow us to what they call break the glass or break the ceiling of a patient record. So say you end up at a different hospital system around town from your primary care visit here, we can request from that practice access to your medical record with your permission and get access to all of the things that we may need to take the best care of you possible.
Fantastic. There's some drywall headed our way, so we're going to walk down the hallway there.
Back this way, around the corner, you're going to see future storage rooms, our IT room, all of the behind-the-scenes nuts and bolts that we're going to need to also operate the space. And then, of course, any health center or any organization needs space for their staff. So we have thoughtfully also built in private offices for our medical providers, for our manager of healthcare operations. We've designed a kitchen and break room for our existing staff, and then some open office space here in the back that will be used for our health center staff, as well as existing CAP staff who are going to use this as a base throughout the week when they need to meet a client out in the community. We've really built our model over the last 30 plus years about meeting clients where they're at, and so if a client is more comfortable meeting on the east side, we can now use our client meeting rooms in the front as an opportunity to meet people on this side of the way.
That's great. So, okay, so there's 10 exam rooms, and how many mental health rooms?
Yeah, 10 exam rooms, 6 mental health counseling rooms, 1 larger room for therapy, lab draw room, and blood draw room.
Wow.
And then lots of open office space as well for our staff.
So when this place is fully operating and all those rooms are being utilized, how many people do you think we'll be serving in the community?
Yeah, we have built into our business plan a slow growth over the first year so that we can make sure that we're providing solid care and that we have all of our logistics worked out. But at full capacity with 10 rooms, we think we have the capacity to see anywhere between 5,000 to 6,000 patients in the future.
That's fantastic.
Yeah, it's an exciting time for CAP, but also for the community. You know, for a city our size, with a growing LGBTQ+ community, we're just excited to be offering these new services and to be the ones to introduce Prism Health to you.
Yeah, and this is how it happens. First, it starts with drywall and insulation.
Installation, yeah.
And I've also heard the building is super solid if earthquake happens, right?
It is. Major seismic upgrades have happened in this building, so it'll be one of the safest places in the city.
Awesome, good, we're ready.
Yeah.
All right, so we're gonna go around the corner here.
So this space that we are entering is our future pharmacy.
All right, a pharmacy.
Yeah, so I think a lot of people don't know that Prism Health will also have an integrated pharmacy service. As an agency that receives federal dollars to support people living with HIV, we qualify for a program called the 340B Pharmacy Program. Sounds super technical. It is. And I'm going to walk this way with you and explain a little bit more about that. As Kim mentioned, active construction site.
Yeah.
I think every few steps we have either been in someone's way or, you know, trying to make sure that we are fully supporting the work that's happening without
I'm
causing too
surprised
much
they haven't asked us to help yet. I mean, we're pretty handy.
Yeah. So let's take a few more steps, get out of their way, and I'll explain our future pharmacy program on our way back out the door. You know, our pharmacy program is one that will really help CAP in the future.
Oh, great.
Why?
Yes.
It is a program that is designed to offer a drug discount program to organizations like CAP.
Okay.
Essentially what happens is that if people transfer their prescriptions to CAP in the future, we would be able to, for certain patients who are living with HIV currently, we would be able to purchase their medications at a discounted rate, but still be able to charge the insurance companies or other payers at the full rate. It's a federal program that is only eligible for certain organizations. CAP is qualified as one. The difference between that cost and what we bill for is then able to be put directly back into programs and services. The benefit is that it makes us more sustainable. It helps us fill the gaps in existing programs that CAP currently offers. And it helps us grow the health center in the future.
That sounds like something that really seems optimistic for us. Like, stuff may be tricky for us down the road, but we're going to have something behind us that's going to help fill those gaps.
Yeah,
Right?
I think in a time of uncertainty and a time of not knowing what stability will exist for federal funding for various health programs, we are really excited to be building into our business plan this pharmacy program that for now and in the future will help the program. We've got some more drywall coming through.
Some more drywall coming through. Good job. Way to go. All right, we should probably get out of these folks' way. They're working hard for a good cause. And but before we go, thank you so much, Tyler, for coming down today and giving us a tour. Is there anything you want to leave us with? Any parting words of wisdom?
Yeah, I think something that's been really important to me as I woke up this morning, I sent an email to all of CAP staff, really trying to reiterate that you know, I know that we're headed into a time of uncertainty. I know that things might seem scary and that we really don't have the answers for what the road will look like in the next year or the next quarter. But what I do know is that CAP and Prism Health remain very committed to the HIV positive and LGBTQ+ community. We've been here for 30 years providing a set of robust services to the community, and we plan on being here for many years to come. And we'll do that by continuing to follow what's happening in DC, by advocating for the rights of people living with HIV and the LGBTQ+ community, and for ensuring that through the ups and the downs, that CAP will always be here as your community partner and friend. So we're going to take off out of this space now before we get any more in the way. But we're really excited to introduce you to this next phase of construction at Prism Health, and we look forward to you seeing this space in person in the next few months.
Excellent. All right. Bye-bye.